Hello, my name is Sean Rader. I did my community health assessment on Bethel, Alaska. The reason I picked this is because at some point in time I plan on moving up into this region and plan on doing some community health work, I hope. Another reason is I'm an avid pilot and there's lots of good flying in Alaska. Bethel, Alaska is a remote rural hub located along the Kuskokwim River, approximately 400 miles from Anchorage. Despite having a population of only about 6,400 residents, it serves as a major center for transportation, commerce, and healthcare for the surrounding villages. According to the U.S. Census data, Bethel functions as a region access point for over 50 rural communities, which significantly impacts both healthcare delivery and resource distribution. The geographical isolation plays a critical role in shaping health outcomes. The Yupik people. The community is deeply rooted in the Yupik culture, with approximately 68% of the residents identifying as Alaska Native. Cultural values such as family, subsistence living, traditional strong influence, health behaviors, and healthcare utilization. The preservation of the Yupik language, spoken by around 1,500 individuals, reflects cultural resilience. Research from the Indian Health Service emphasizes that cultural competent care is essential in improving outcomes in the native populations. One of the most significant changes in Bethel is the lack of road connectivity. The community relies heavily on air travel, boats, and snow machines for transportation. According to Alaska Department of Health data, the limited infrastructure contributes to delayed care, higher cost, and reduced access to essential services. Additionally, limited sanitation and housing further increase health risk. And during the winters, most of the roads are iced over, so become 100% reliant upon aviation for most of their services. Healthcare in Bethel is primarily provided by the Yukon Kuskokwim Health Corporation, a tribal health organization. This facility provides comprehensive services including medical, dental, and mental health care. However, due to its remote location, the system relies heavily on air transport for advanced care. The tribal healthcare model is important because it integrates cultural appropriate care while addressing regional health disparities. The social environment in Bethel is a strong influence by the Yupik's traditions. They focus on family, community, and subsistence lifestyles such as hunting and fishing. These factors serve as protective health assets by promoting strong social support networks. According to Healthy People 2030, social cohesion is a key determinant of improving health outcomes in rural populations. Bethel's physical environment presents extreme challenges, including temperatures reaching negative 40 degrees, long winters lasting up to 7 months, and extended periods of darkness. These conditions contribute to increased rates of respiratory illness, seasonal depression, and limited mobility. Environmental health research shows that harsh climates directly impact both physical and mental health outcomes in the Arctic populations. This community health assessment focused on 5 key social determinants of health: access to healthcare, education, housing, chronic disease burden, and employment. These determinants are identified by the CDC as major drivers of population health and are particularly relevant in rural and underserviced communities. Access to healthcare in Bethel is limited due to geographical isolation, weather-related delays. Specialty care is often unavailable locally, requiring patients to travel long distances. According to the CDC rural health data, that barriers result in delayed diagnosis and poor outcomes compared to urban populations. Bethel experiences a high burden of chronic diseases, particularly respiratory illness and diabetes. Children are hospitalized for respiratory conditions at rates significantly higher than the national average. Additionally, diabetes prevalence ranges from 6 to 13%, which exceeds the national average. Substance abuse rates are also elevated, with alcohol use disorder affecting approximately 16% of the population. These findings align with CDC and Indian Health Service reports on rural Alaska health disparities. Educational attainment in Bethel is lower than national averages, with reduced high school graduation rates and limited access to higher education. According to the National Center for Educational Statistics, education is strongly linked to health literacy, employment opportunities, and long-term health outcomes. Housing overcrowding is a major concern, with rates 5 times higher than Alaska average and up to 10 times higher than the U.S. average. Approximately 35 to 40% of homes experience overcrowding. These contributes to increased transmission of infectious diseases, particularly respiratory illness. Limited sanitation further exacerbates these risks, as supported by CDC environmental health data. Employment opportunities in Bethel are limited and largely seasonal, with many residents relying on sustenance living. According to the Bureau of Labor Statistics, economical instability contributes to poor health outcomes for limiting access to health care, nutritious food, and stable housing. Despite these challenges, Bethel has significant strengths. Strong cultural ties and community support systems provide resilience. The tribal healthcare system and community health aid program improve access to care in remote areas. Additionally, telemedicine is expanding and has the potential to significantly reduce access barriers in rural Alaska. Key weaknesses include geographical isolation, limited specialty care, high rates of respiratory disease, transportation barriers, and workforce shortages. These factors collectively contribute to health disparity and reduced healthcare access, as identified in rural health literature. The Community Health Assessment utilizes the CDC Change tool as the primary framework. This tool allows for a structural evaluation of community health needs across multiple sectors. Supporting frameworks include Healthy People of 2030 and Social Ecological Model, with emphasis multi-level influence of health outcomes. The methodology is supported through secondary data analysis using sources such as the CDC, U.S. Census Bureau, Alaska Department of Health, and Indian Health Services. These sources provide reliable data on population demographics, disease prevalence, and socioeconomic factors, ensuring an evidence-based assessment. Key data sources include the U.S. Census Bureau, Bureau of Labor Statistics, National Education Database. These sources provide comprehensive data on economic, educational, and workforce trends, which are essential for understanding social determinants of health in this population. This community health assessment supports Bethel by identifying priority health issues, guided targeting interventions, and promoting early detection and prevention strategies. Evidence-based planning is essential for improving long-term health outcomes in rural communities. To effectively communicate findings, this assessment will be shared through community and tribal meetings, local radio broadcasts, community health aids, and digital reports. These methods ensure cultural appropriate and accessible communication, which is critical for community engagement and successful intervention implementation.